Hello, today we will be demonstrating how to insert a nasogastric tube. So I'm going to hand hygiene, foam in, come on in. Hi Mr. Smith, my name's Carla, I'm going to be your nurse today and I verified your orders. The doctor has ordered a nasogastric tube. So I'm going to explain to the patient what that is. It's a tube that's going to go ahead and go in through your nose, down into your stomach. I'm going to go ahead and provide for privacy, and then I have my supplies gathered. Also, I do want to, before I start, verify my two patient identifiers. Mr. Smith, can you tell me your first and last name and your date of birth? Thank you. All right, so let's kind of review the supplies that we need to insert a nasogastric tube. This does involve an assessment before you are inserting the tube. So you want to make sure you have your stethoscope with you. We also want to have a pen light in order to assess patency of the nares. You want to have a nasogastric tube. It comes in a package that looks like this in the supply room. It's called a Salem sump. And then you also want to have some tape because we are going to use that when we're measuring our tube and also when we're securing it. You also need gloves. You need a 60 ml syringe that we're going to use to verify placement. You need some lubricating jelly, water with a straw. You need a basin along with the litmus strips or the pH paper that we're going to measure the gastric content with. All right, very good. So then we're going to go ahead and we're going to start. We've already explained to the patient what's going on. I also want to communicate to him that in the process of inserting this nasogastric tube, if you need me to stop, I want you to raise your right arm up, okay? And then we'll pause. Also, when you're inserting these, the patient should be straight up at a 90-degree angle. This is as high as the bed goes, so we'll use our imagination. Next, I'm going to go ahead and perform an assessment. Mr. Smith, is it okay if I look and inspect and listen to your belly? And he says, yes, it's okay. So we're going to do an abdominal assessment. So I'm going to go ahead and lift the gown up and I'm going to inspect. I'm looking for any distension, any areas that might be concerning. After inspecting, I'm going to go ahead and auscultate next. So I'm going to start in the right lower quadrant and I'm going to listen for vowel sounds in each quadrant. All right. For purposes of time, we're going to do that rather quickly. But then after listening, then you're able to palpate the abdomen, assessing if there's any pain or tenderness as you're doing that. Mr. Smith, are you experiencing any pain? No, he's not having any pain at this time. All right, thank you. All right, so next I'm going to make sure my bed is at good working height, and then I'm going to assess each nares looking for patency. So I'm going to shine, Mr. Smith, I'm going to shine a light in your nose. Very good. I want to just make sure also that he has not had any recent nasal surgeries. All right. The next step that we're going to do is we're going to go ahead and measure the tube for placement. So we're going to start with the nose, and then we're going to go to the earlobe. And then from the earlobe, we're going to measure right down to that xiphoid process. All right. Once we have that measured, we're going to take a piece of tape, and it is okay to pull that off ahead of time. And I'm going to measure that tube with my tape. I'm going to mark it with my tape so it is in place. All right. And the next thing that we're going to do is prepare for insertion. So I'm going to go ahead and don my gloves. At this time, I'm going to go ahead and prepare my patient. I have them sitting straight up. I'm also going to give the patient, or you may have another coworker hold the water for them. As you're inserting the tube, you're going to have them swallow and take small sips of water. So I'm going to go ahead and have him hold that. I'm going to grab my tube and I'm going to lubricate the end of it. So I'm going to take my lubricant and I'm going to to lubricate that. And then I'm going to go ahead and prepare to insert my tube. All right? So I'm going to start by inserting it. And when the tip of the tube passes back towards the nasopharynx, I'm going to instruct the patient to put their chin all the way down to their chest, and then I'm going to advance it. So for the purpose of advancing this, I'm going to use it on our mannequin over here. So instructing the patient to put their chin down and take sips of water, I'm going to go ahead and insert it in through the nose. And I like to sometimes just gently put my hand behind their head, and I'm going to tell them, please swallow. And every time they swallow, please swallow. Every time they swallow, I'm going to go ahead and advance the tube. Okay? And I'm going to advance it until I get to the mark on my nasogastric tube. Once I have inserted it, I'm going to go ahead and I'm going to ask the patient to open their mouth, and I'm going to look at the back of the throat to make sure that the tube is not coiled inside the patient's mouth. All right? From there, I'm going to go ahead and take my tape, and I'm going to go ahead and secure it onto the patient's nose. There are hospitals have usually special securement devices that can be used. Here in the lab, we're just going to be using a piece of tape to secure that on. We also want to take some of that pressure away from the patient's nose. So we're going to use a piece of tape to apply to the cheek, and then we're also going to apply to the patient's gown, the tube. Okay? All right. Once we have the tube in, it's very important that we verify placement of the tube. So when we verify placement, there are 3 different techniques that we can use. Probably the most important one, especially if you are putting any liquid through the tube, is to do X-ray to confirm placement of the tube. 2 secondary checks that you can do is using an air bolus, and this is where you are going to have your stethoscope out. You're going to be listening over the gas drum, and then you're going to insert air through the tube, listening for the air movement in. The other route that you can confirm placement is pulling back the gastric contents and measuring the pH. So we're looking for the pH for gastric contents to be between 1 and 5. So I'm going to pull back until I have gastric content, and then I'm going to go ahead and put that in my basin, and then I'm going to take my strip and I'm going to measure the pH with the gastric content, and then I'm going to look at the indicator markings here to verify that it's between 1 and 5. All right. After I have confirmed placement, I want to go ahead and make sure that I perform oral care, that I clean up my mess over here. I'm going to discard my supplies that I don't need anymore. I'm going to go ahead and put my bed back down in low position, answer any questions that the patient may need, make sure my side rails are up, also performing hand hygiene, and then finally I'm going to make sure I document the procedure. All right, thank you.